get pain on the front side of your knee, on the kneecap, on the inside of the knee, or even the outside of the knee? If so, you may have trigger points in your quadricep muscle. Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the quadricep muscle. The quadricep muscle is the heaviest muscle in the body. It is the front of the thigh, so it is made up of 4 different muscle bellies for quadricep. It's going to have one muscle that crosses 2 joints, the hip as well as the knee, and 3 muscles that are going to go from the femur, that large bone of the thigh, and across the knee and attach into what is called the tibial tubercle, and it's where every one of those muscle bellies is going to converge on a common tendon, which is the patella tendon. So the 4 different muscles, the first one is rectus femoris, and it's going to go from the ASIS, which is the anterior superior iliac spine of your hip, and it's going to go right down the very front and attach into the tibial tubercle via the patella tendon. Then you've got the vastus medialis, which is going to be the inside of the thigh. So you're going to get the inner part of the vastus medialis, and then you're going to have the vastus lateralis, which is going to be on the outside femur, is going to go down and again converge on that patella tendon. And then you have the vastus intermedius, which is going to be on more of the outside next to the rectus femoris, underneath there, and right next to the vastus lateralis. So the intermedius is going to be in between. Rectus femoris is going to be right on top, crossing those 2 joints. So that is the quadricep muscle. You can have trigger points in any of those muscle bellies. If you have trigger points in your vastus medialis, you may have medial inside knee pain. If you've got trigger points on your rectus femoris, you may have pain right on the kneecap. If you've got pain on the vastus intermedius, you may end up pain on the upper part of the thigh. And if you have pain on the vastus lateralis, you may have pain down the side of the leg, the kneecap, and the side of the knee, the outside of the knee there. So this muscle can contribute to knee pain. It is one of the muscles that I will commonly check if there is pain on the front of the knee. Now, how do you develop trigger points in that muscle? It's from excessive overload. So if you've got really tight hamstrings and you're just staying in a crouched position and using those muscles repetitively, you can develop trigger points. If you have a misstep and you overload the muscle quickly, you can develop trigger points in that muscle. So we're going to invest a quadricep muscle. I'll show you how to trigger point release different areas of the muscle, and then we're going to stretch it. So we want to go in, we want to release those trigger points, and then we want to restore the muscle-tendon relationship by stretching the muscle, and that may help to reduce the knee pain if the knee pain is coming from those trigger points. Now, trigger points, those are just going to be areas where the muscle is overcontracted, and we have what you call spindles inside the muscle that tell how much force, and until you go in and you reset those spindles, there's a signal that sends back to your brain that there's still danger there. And so even though there's not danger, your spindle is still set trying to tell you that there is, and that's going to refer pain down into the knee. So I'm going to start with a foam roller, and then I will progress to a double lacrosse ball. So you want to start with a wider, softer surface area and progress to a more narrow, firm surface area. To release the quadricep, or to address the trigger points in the quadricep, I'm going to foam roll my thigh. So the front of the thigh, I'll go onto my elbows, and I'm going to start on the rectus femoris. So I'm going to go just on the very front of my thigh, keeping my feet in neutral, and I'm going to investigate all the way down into the top of the knee, but not over the kneecap. And then I'm going to go really slow. So if you feel like you're going slow, go slower. And I want to go all the way up to my hip, just below the ASIS. So not on bone, but up towards the very top lower portion of the pelvis there. So I'm going to investigate. And I can go through and just find any areas that feel like they are tense or tender. And if I find a spot that is tender, I can hold there. And then to mobilize that muscle while I'm putting pressure can further help to release that area. So I'm going to release my quadricep and the fascia by bending that leg and then straightening it back out. So I'm just going to go through that range as I'm holding pressure on the trigger point or the tight area. And then I'll turn my toes inward, and that's going to get more on the outside. And I can even angle my body towards the outside. A lot of adhesions are between the vastus lateralis and the iliotibial tract. So there's a big thick band that goes on the outside of the leg. And I can just angle and work on each side that way, or keep those toes turned in like pigeon toe position and work on getting that vastus lateralis. And then I can turn my legs the opposite direction, so I can turn them out and work more on the vastus medialis. So I can work and investigate on the inside. And again, if there's any tenderness, you can angle, put pressure, and then bend and straighten that leg through that range to address the fascial tension, which is the connective tissue that wraps the muscle, as well as mobilize the area while you're holding down on the trigger point. You want to work on those for about 2 minutes at minimum, and you want to hold down on the trigger point for about 20 to 30 seconds to release the trigger point. You can hold a little bit longer. A successful release is when you're holding and there's a reduction in either tenderness or you feel the tension reduce. So that is the trigger point release of the quadricep muscle. And after, if this is getting easy for you, you can progress to the double lacrosse ball. And it's the same idea. You're going to go down the same muscle groups, but I'm going to use that more firm, smaller surface area and then follow down. So if I go onto my stomach, I can just investigate there. So you can see on this one, I'm just going to go down the front of the thigh. And then I can hold where I feel any tension, and I can bend that and straighten that back out. So the lacrosse ball is going to give a little bit more firmness and pinpoint location on different areas of those muscle bellies, so that can be more effective if the foam roller is too easy or it seems like you're progressively improving and still having some trouble. You can investigate with a firmer, smaller, or more narrow surface area. After I have released the trigger points and mobilized the fascia, I'm going to stretch the muscle by just bringing my heel to my buttocks and pointing my knee straight down in line with my other leg. And then to get more of a stretch on that rectus femoris, I can extend the hip and bring that leg back, and I should feel a nice stretch through the front of the thigh there. And that is going to be my quadriceps stretch. So it's a release and then it's a stretch. And if you have improvement in the knee pain after you've completed that, then you probably have had developed trigger points in the quadricep muscle. I hope this is of help and have a blessed day. Thank you.